Julie Courtney is an agent manager with United Health Group. Good morning, Julie Courtney.
Good morning.
Your job is trying to explain Medicare to us?
Yes, it is.
Oh, that is, she must be really, really smart.
I wouldn't say that.
All right. What is National Medicare Education Week?
National Medicare Education Week, it's actually an official week that we dedicate to helping seniors, Medicare beneficiaries, those that are getting ready to retire, just educate, make them aware of what Medicare is, and to just really get them the information so that they can make an informed decision once they join Medicare and they understand how Medicare works.
How does Medicare work?
Well, Medicare works when someone turns age 65, they automatically get Medicare Part A, which is the hospitalization coverage. They can elect Part B, which is the outpatient and the doctor visits. And then at that point, they'll have a choice. They can either take a Medicare supplement plan because Medicare does not cover 100%, or they can take a Medicare Advantage plan.
And what's the difference between the supplement and the Advantage plan, though?
The difference between the supplement and the Advantage plan is the supplement is it's a fixed premium cost each month, and beneficiaries have the option to choose whichever provider they would like to go to. It just offers a little more flexibility on the provider network. And then a Medicare Advantage plan, those are the plans that you'll hear a lot of times. There's either a zero premium or a low premium, and those plans have a provider network associated with them. And generally, they will also have a primary care physician that'll kind of oversee all of your care and direct you to specialists as needed.
Why would you choose one over the other? What are the advantages of one over the other?
Well, as we know, Medicare is not a one-size-fits-all. So a Medicare Advantage plan that may work very well for one person, it may not be suitable for another person. And, so when you're turning 65 and you're going on Medicare, one of the things that you want to take a look at is your current health condition. You want to look at your provider network. You want to look at what kind of goals you have as far as health so that you can get a plan that's going to cover all those needs.
I've heard that Medicare Advantage is for those that are relatively healthy, and the supplement is for those who are not as healthy, I guess.
And I've heard that too, and that's certainly not true. Really what we do is you have the option of a Medicare supplement or a Medicare Advantage, and like I said, it's just really, up to the individual and their needs. You don't need to be, healthy or unhealthy for one or the other. Both plans can fit just fine based on your health.
I've heard that the Medicare Advantage doesn't really take care of skilled nursing, though. Is that true or is that not true? If you get older and you start to need some skilled nursing, that Medicare Advantage doesn't cover that.
That is not true.
Not true.
That is not true. On the Medicare Advantage plans, Medicare, when we do our plans, it is set that our plans have to be either comparable to what Medicare offers or better. So on the Medicare Advantage plans, we cannot take out benefits that regular Medicare would not cover.
Again, I'm still confused. Why would I choose one over the other? Why do we have two? I don't understand. What's better than one or the other?
The option for two, on the Medicare supplement, there is a fixed premium each month. So you will have that fixed premium each month. You will have the ability to see any provider that accepts Medicare. On the Medicare Advantage plans, generally, since they are zero premium or lower premium, you will have a set of providers that'll help direct your care and oversee that. And then by doing that, you'll have co-pays and some out-of-pocket, some deductibles, things like that when you go and get your care.
So is it a sense that if you are sicker, the Medicare supplement takes care of that, but if you're not as sick, you want to go with the Medicare Advantage?
That's not true. On the Medicare Advantage plans, there's many options of providers. You're not going to get any lesser care because you're on a Medicare
I understand it, but
plan.
it's more or less like pay me now, pay me later, right? So nothing up front. I don't have a monthly fee.
Right.
And I pay the copay, or I have a monthly fee and I don't pay a copay.
Correct. You're looking at it just the way that, we'll even explain it too, is on the Medicare Advantage, you basically pay as you use it. Mm-hmm. So if you don't go to the doctor 1 month, you don't go to the doctor for 3 months, then, virtually you're not anything out of your pocket.
Well, that sort of lends me to think that if I'm a healthy 65, I'd want to go with the Medicare Advantage, because if I'm not going to the hospital, why do I have to pay for it?
Right.
But
And
the 65-year-old becomes 70 at some point, and then ultimately they are going to start going to the hospital. So can you switch from one to the other?
You can. There's different open enrollment periods throughout the year. It would just really be based on what your situation is on what would trigger an election period for you to go into a different plan.
So, for example, what triggers a change of?
For instance, if you move out of a service area, or let's say you're over 65 and you're on Medicare and you're currently getting group health benefits and you've decided to retire now that you're 70, there's just different instances that will give you an election period to change plans.
Okay, you mentioned A, you mentioned B. Is there a C?
There is Medicare Part C is also known as Medicare Advantage plans.
Okay.
Generally, we don't refer to them as Part C, but that's
Okay.
what they're known as.
Part D is the prescription
Yes.
plan. Right. How does that work?
Medicare Part D is the prescription drug benefit. And how that works is if an individual elects a Medicare supplement plan, they will at that time purchase a Medicare Part D plan, which is separate from the supplement. And that will cover drug costs, not all of your drug costs. And then on the Medicare Advantage plan, that Part D benefit is built into the Medicare Advantage plan. So on the Medicare Advantage plan, it'll encompass all of your benefits under one umbrella. Whereas the Medicare Supplement plan, you would have your Part A, your Part B, your supplement, and then your Part D.
When should you say you're, in your 60, 62, 63, when should you start thinking about enrolling in Medicare?
Typically,
And if you're still working, you don't need to do that, right?
correct. As long as you're getting your health benefits through your employer, that's something that we always tell people that, definitely when you turn 65 and you get your Medicare Part A, is to check with your health benefits administrator at your company to make sure that you don't have to elect Part B. And we always just tell people to make sure that you check with your employer to make sure that it's not going to impact your current group benefits that you're being offered. But we really do encourage people, prior to turning 65 to start educating yourself, start looking into what your options are. And really what United Healthcare did with National Medicare Education Week is, we design Education Week so that we can get those that are turning 65, their caregivers, loved ones, anybody that's helping them make their Medicare decisions, this is an opportunity to come in and get educated on how Medicare works, when you should start, taking your elections. We go over, the difference between a Medicare supplement and a Medicare Advantage. Like I said, it's not one size fits all. So a Medicare Advantage plan that may work very well for one person may not be the answer for another person.
Let me ask you this question. So somebody goes in there, they're trying to decide between the supplement and the advantage. Does the supplement and the advantage cover the same thing? In other words, regardless of if I'm going to pay a monthly fee or I'm not going to pay till I walk in the door, does it cover the same thing?
Yes. Virtually the same thing. When Centers for Medicare comes to us and we present our plans, the supplements and the Medicare Advantage plans both have to offer what Medicare would have offered or better. So you're going to get the same health benefits. However, on a Medicare Advantage plan, they will offer some extras like some of the gym memberships, some hearing aids at a copay level, some vision, and some preventive dental.
So you don't get hearing aids with the supplemental?
Correct.
What are we talking about cost-wise here?
Cost-wise, it will vary. It also depends on when you go in to take your Medicare Part B. There's a lot of people that continue to work these days that are not retiring at age 65. So they'll continue to work and they'll be under their employer's health benefits. So there is no need generally for those people.
Right, but
to
I mean,
get
are we
Medicare.
talking $100 a month? Are we talking $1,000 a month? Are we talking $5,000 a month?
Well, when someone turns 65 and they elect their Part B, it's a set premium. Generally, most people will pay $105, $104 each month for that. That's something that they'll always pay regardless if they take a Medicare supplement or if they take a Medicare Advantage plan.
Right.
And then as far as the Medicare supplements, the other thing that we encourage people to do is to also look into the rates for the Medicare supplement plans. Those are regulated. So a Medicare Plan F with, say United Healthcare is going to be the exact same health benefits as it would be with another company's Medicare supplement.
Pretty
plan.
confusing. Julie
Wow.
Courtney with us, agent manager, United Health Group. It's National Medicare Education Week all week long. Julie, thanks for checking in.
Thank you.
You got it. 7:30, Big 5.